Hey guys, hi, welcome to Unacademy. This channel is Unacademy Future Doctors, and I'm your educator for biochemistry here as well as on Unacademy App. I'm Dr. Shivangi Shukla. Let me just check if I'm visible and audible to all of you. I'll just quickly see if the live stream has started. Okay, great. So I have been taking the two questions per day series. Most of you have been regulars on it. For the past 2 days, I'm taking two questions per day series and three sessions each day I'm taking. So we are cumulatively discussing six questions per day. And through these six questions, we are discussing major chunks of the syllabus of biochemistry, the major important subtopics. Okay, so every month, whatever we cover during the first 3 weeks of the month, I make it a point that I keep the last week for revision. Okay, and revision can be made interesting through different techniques. All right, so I have come up with this 2QPD series right now, which will make it interesting for you guys. Right? Uh, Hello everyone. Hi. So, all of you would be knowing about me. I'm Dr. Shivangi Shukla. All of you here on this channel are regulars. Here about the NEET PG subscription, there are two types of subscriptions for NEET PG available on Unacademy, the Plus as well as the Iconic subscription. Both of them will give you access to video lectures from top educators across the country, and not just live, but you can watch the video lectures recorded as well on on the speed preference of your choice. Okay, and you also on top of that you will get the PDF notes also for the of the educator and the PDF notes of the concluded classes. Okay, also you'll get access to a question bank containing more than 25,000 questions, and it gets updated regularly, keeping in view the updating trends in the subject. And there are regularly conducted live quizzes, and you can use various state of the art technologies like polls, raise your hand feature, ask a doubt feature, doubt solving from the educators. Okay, and the Iconic subscription will also give you additional access on top of all of this. It will give you additional access to resources from Prep Ladder as well. Okay, so do consider these. The prices are already subsidized, and on top of the already discounted prices, you can avail a 10% discount on top of that while checking out. And this discount can be availed if you apply the coupon code DRSHUKLA. Okay, so this code DRSHUKLA, Dr. Shukla, this code is going to fetch you an additional 10% discount over and above the already inexpensive rates. In today's scenario of increasing COVID cases outside, when most of the learning has shifted towards the online format, it is imperative for all of you to utilize it to the maximum. Okay, and Unacademy is offering you quite inexpensive rates which you can utilize. Okay, and this additional discount will also be beneficial, so do consider it, guys, because it is going to introduce regularity in your learning. Okay, now, so as discussed, as already told, I'll be discussing two questions in this session. The first one is here. I'll be giving you 5 minutes to answer each. Okay, so the question is: all of the following are proteins except hexokinase, peptidal transferase, insulin, or glucose 6 phosphatase. All right, understood the question? Now your 5 minutes to answer start now. Okay. Try and understand what the question is asking of you. It is a kind of applied concept here. Try and answer this. Most of you know this. It is not very difficult. It is just that I have framed the question a little bit differently. Try and answer this. Hmm? Come on, everyone, do answer. Excuse me. Every one of you do attempt this. It's a kind of an easy question. You just have to be, it is just framed differently. Try and answer this. All of you can answer this. You know this. And then we're going to discuss the concept behind it. Okay, we're going to study the whole of the concept behind the correct answer. Okay. Come on, I don't see much answers coming in. Try and attempt this, guys. Not very difficult. All the following are proteins except, okay, A. Hexokinase, B. Peptidal Transferase, C. Insulin, or D. Glucose 6 phosphatase. Is there something similar amongst most of the options? It's nothing that I'm giving you. I'm just trying to speeden up your thought process. Try and answer, all of you. Come on, guys, try and answer this. Last 2 minutes left. Last 2 minutes left for the answer to come in. Try and think about it. Try and think it through. And guys, last 1 minute. You have to choose which of these are protein and which is not. There is one amongst the option which is not protein. Okay. All right. Can you tell that? Can you decide which one of this is not a protein? Okay, so last 30 seconds and then I'll be out with the answer, okay? So the correct answer is not C. No, insulin is a peptide hormone. Insulin is a protein. So A, B, and D all are enzymes. As the name suggests, A's, they're all enzymes. Okay. So most of you would be thinking that the answer is C, which is not an enzyme, insulin. But guys, just yesterday we discussed the structure of insulin in this series only. Insulin is a peptide. It is a protein. So the correct answer is not insulin, but Peptidal transferase. Yes, in spite of being an enzyme, it is not a protein. Okay. Peptidal transferase is an example. It is an important example of an enzyme which is not a protein. So what does this tell you? This tells you that all enzymes are not protein. Okay. Alright. Neither are all proteins enzymes. Like insulin. Insulin is also a protein, but it is not an enzyme. Alright. So all enzymes are not proteins, but most of the enzymes are proteins. But there are some other substances also, other molecules also, which can have enzymatic activity. And one amongst them is the ribozyme. That is an RNA that behaves as an enzyme. And that is what our peptidal transferase is. Okay, our peptidal transferase is a ribozyme. It is an RNA that behaves as an enzyme. Alright, so where is hexokinase involved? It is involved in glycolysis. It converts glucose to glucose 6-phosphate. Insulin is a hormone. It is a peptide hormone involved in glucose homeostasis, secreted by the beta cells of the islets of Langerhans of the pancreas. Glucose 6-phosphatase, where is it involved? It is involved in gluconeogenesis when it converts glucose 6-phosphate to glucose. So D is the opposite of A. What A does, glucose 6-phosphatase, what hexokinase does, glucose 6-phosphatase does the opposite of that. Alright. Now we'll talk about peptidal transferase. Peptidal transferase is involved in peptide bond formation during the step of elongation in translation of proteins. Okay. Let us quickly revise translation of proteins through this question. Okay. Now there are three steps involved in translation: initiation of translation, elongation of the protein chain, and termination of the chain. Okay. Now the initiation involves, this is the summary, dissociation of the ribosome into 40S and 60S subunits. Now the eukaryotic ribosome is 80S type. It is of 80S type and it has two subunits, 40S and 60S. Now the prokaryotic ribosome is of 70S type and it has two subunits, 30S and 50S. Okay. Now the first step in translation involves dissociation of the 80S ribosome into 40S and 60S subunits. Now 60S will stay apart silently and wait for its turn to come. This 40S unit will now come into play. Okay. Now the second step is when a ternary complex means involving 3 units. This complex has 3 units. Binary complex has 2 units. Ternary complex has 3 units. So this ternary complex having methionated tRNA, that means tRNA containing methionine as the amino acid. Okay. Now each tRNA molecule is activated where it is attached to a particular amino acid through a unique amino acyl transferase enzyme. Alright. Now here this tRNA, this is amino acylated with methionine. Okay. Now this plus GTP plus the initiation factor 2, eukaryotic initiation factor 2, they form a ternary complex and get bound to 40S subunit. Okay. Now this forms a pre-initiation complex. Now what happens is the activated mRNA is bound to this pre-initiation complex to form the initiation complex. Okay. Now this initiation complex will go and bind to the 60S subunit which was patiently waiting for it to then form the 80S initiation complex. Okay, with this the initiation is completed. Understood? So we'll quickly see the steps. The first step is ribosomal dissociation into the 60S and the 40S subunits. Alright. Now, similar to the single strand binding proteins, which were preventing the two DNA strands from annealing together, this initiation factor 3 and initiation factor 1A will bind to 40S subunit to prevent 40S and 60S from sticking together. Okay. Now, how is the pre-initiation complex formed? I told you a ternary complex will go and associate with the 40S unit. What is the ternary complex? Initiation factor 2, GTP and methionated tRNA. Okay. Now this pre-initiation complex has formed. Pre-initiation complex is our hero. What is the heroine? The heroine is mRNA. The mRNA has been decorated with the cap. See, the hero is decorated with the ternary complex. Okay. The hero 40S has been decorated with the ternary complex, initiation factor 2, GTP and the methionated tRNA. Now it has become the pre-initiation complex, the decorated hero. Now the heroine is mRNA. It is getting decorated through capping and tailing. After capping at 5' position and tailing at 3' position has been done, and now its brother will come and guard it. The brother is 4B, initiation factor 4B. Now what happens is the hero will come and will sit on the hero will come and will associate with the heroine, and then what happens is the hero reads the face of the heroine. Okay, the hero is going to read the face of the heroine. How? Through translocation. So what is moving? The ribosome is moving over the mRNA. Always remember, this is the question that is asked. The hero is reading the face of the heroine. Okay, similar to Bollywood songs, the Bollywood movies. Okay, the hero is reading the face of the heroine. So this ribosome is going to translocate over the mRNA, and whenever it finds the initiator codon, that is AUG is the initiator codon. This initiator codon has Kozak consensus sequences around. What are these sequences? At 1 base pair upstream and 3 base pair upstream from AUG, there should be present purines. Purines should be present. So that is the exact site where the translocation should start. Okay. Alright, so this is the summary. See, the ATS subunit has dissociated, and the 40S male has been decorated with the ternary complex. Then the mRNA female is getting decorated, and then the male will read the face of the female. That is, the pre-initiation complex is going to read the face of mRNA, and that is going to form the initiation complex, and then it joins with its long lost brother, that is 60S, to form the 80S initiation complex. This 80S initiation complex has 3 subunits. What are these 3 subunits? They are this 80S initiation complex has 3 sites. What are these 3 sites? E site, P site and A site. Okay. Now these 3 sites, Muro is saying there is lag. Muro, please check your internet connection once. There seems to be lag in live stream. In your internet connection, okay? If the internet connection is not stable, so please check your internet connection, alright? Now, what happens is this these 3 sites, that are E site, P site and A site. Now what is the function of these 3 sites on the ATS? The P site has the methionated tRNA that contains the first initiator amino acid, that is methionine. Okay. A site will have new tRNA molecules with new amino acids coming in. Now during the process of elongation, what will happen? The peptide bond formation will occur. What is the peptide bond formation? Peptide bond formation is between the the A site and the P site. Okay, the tRNA containing amino acids on the A site and the P site. Understood? So what will happen is this peptide bond formation is catalyzed by what? by peptidyl transferase, and this is what we are discussing. This peptidyl transferase is the ribozyme. What is this? It is the ribozyme which has, it is the RNA which has ribozymal activity. Okay, what is this peptidyl transferase? It is 28S RNA of the 60S subunit. That means it is an RNA. Okay, peptidal transferase is an RNA that has enzymatic activity. Now, the P site, the amino acid on the P site is going to get attached to the amino acid on the A site, and then what is going to form? Uh, two amino acids will be connected together. Okay, now this tRNA which has given its amino acid to the A site, this tRNA will move out to the exit site and go out. Now new tRNA will come, and the tRNA on the A site will then hop on to the P site. So new tRNA molecules always come at the A or the acceptor site. Okay, E site is the exit site from where the tRNA molecules will exit after they have given their amino acid to the peptide chain, and A site is the acceptor site where new tRNA containing amino acid joins in. Okay, and P site is one where from the A site the tRNA molecule will hop. Okay, understood? So So this is the next question, which is, which of the following is or are properties of the genetic code? Alright. Now there are four options to this. Is it unambiguous? Is it degenerate? Is it non-overlapping, or all of the above? Okay. Which of the following is or are properties of the genetic code? Now you'll be getting 5 minutes for this as well. Alright. Do try and answer this. 5 minutes for this. Okay. I hope the question is visible on your screen. Which of the following is or are properties of the genetic code? Alright. I just finished with the discussion of translation to the peptidal transferase, and by discussing the the activity of peptidal transferase, and now we are going to discuss about the genetic code. Okay, which of the following is or are properties of the genetic code? A, unambiguous, B, degenerate, C, non-overlapping, or D, all of the above. Alright. Now you are getting 5 minutes to answer this. Come on, everyone. What is the meaning of each of these terms? Also, you should understand. Ambiguous, degenerate, non-overlapping. What is the meaning of these, and what are the other properties of the genetic code? Okay, last one. Do this answer. Come on, everyone, try answer this. There's a fine line of difference between unambiguous and degenerate. I hope all of you know that. The difference between unambiguity and degeneracy. Okay, so you try and answer in the chat section. The question is, which of the following is or are properties of the genetic code? A. Unambiguous, B. Degenerate, C. Non-overlapping, or D. All of the above. Okay, can you tell me? Very good, very good. It's all of the above. And now I'll tell you the answer. The reason, see, what are the properties of the genetic code? First of all, the genetic code, it is a unique code for each amino acid. Okay, now what are amino acids? Amino acids are components of proteins. Now what are these proteins? These proteins are the expression of the genes, isn't it? The genes that are coding, that are present in the DNA, they code for some characteristics of the entire body. Now the code that is present in the gene is translated into the amino acids of the proteins. Okay, so the code that is there in the genes is translated into the amino acids. The amino acids are encoded for by a triplet codon. Okay, this triplet codon means there is a 3-letter code for